Hi guys, thanks for tuning in. Today we're going to talk about back pain and how to release the QL, one of the primary sources of back pain. A pain that can be aching pain and acute pain depending on the cause. The cause can be because you're sitting too long, the poor posture, the weak muscle, unequal length of the legs, can be a trauma. The way I like to start my session is with a sacroiliac ligament myofascial release massage. I start in a deep depression between the sacrum and the ilium, and I go all the way to the PSIS. This technique improves the local circulation and it's softens the scar tissue. It's a great technique for especially with people with contra-nucleated sacral, but it's not the case of this patient because when it's contra-nucleated sacral, ligament can be really tight, so it needs some stretching, even if it's really difficult to stretch a ligament. But we try just to work on a scar tissue. In this case now we're working from the PSIS and we go all the way down, try to work that part that has a close anatomical relationship with the rectospinal, that is the thoracolumbar fascia, and the ilium, that are the attachment of the QL. The QL is the muscle we're going to work now. It's the most important muscle for what is related to back pain, as I told before. And we're going to work on active engagement technique, working with isometric contraction and release. Working in this way, we allow the fiber to contract and to release, and to create a better environment for the massage, because we use the inhibitory reflex of the Golgi tendon to go deeper in the massage after the contraction. So as you can see, I ask my client to shorten the leg and then make it longer. Great technique, great way to release the QL. Another technique I use is the pin and stretch of the QL. You got to really watch out when you have a client with hyperlordosing not to go too deep, but you can stay on, you can press, instead of pressing down, you can press on the side. Now I'm working on the glute medius with opposite contralateral work on what I was doing before, and now I'm stretching to create space in the spine with this simple stretch that I take from Thai massage. So you grab the PSIS and you press in the opposite direction on the thoracolumbar fascia. Another technique that I like to use is the myofascial release for the rectospinous. I steal this technique from Tom Myers and Anatomy Trains. In the way I do it is like I grip generally on the trigger point and I try to stretch the fiber in different direction. In this case is the direction of the muscle. That can be the longissimus, it can be the iliocostalis, depends how deep you are, and allow them to create space and circulation in the fiber, because what you want to do is try to disintegrate the fiber that are like tight in a knot, and this technique is perfect for that cause, for that symptom. Another way is the cross fiber erectospinal technique for the QL, and for mostly for all the muscle of the lower back. I use this technique for even if you have no back pain, because it's really pleasurable, and the client really like it, because it's what's happening, the back become really hot, and they have this sensation of hot and heat in the back that is a sign that is improved circulation in the muscle. So you want to grip the fiber and go really deep. A way to do it, you can even ask the client to go in the opposite direction of the direction of your arms to create more traction. So guys, if you like this massage, if you like my technique, subscribe. And I try to come every week with a new video. Thank you very much.